There's two studies that we presented. One was looking at active surveillance in men who start active surveillance at an age under 60, so younger men. Historically, people have avoided active surveillance in younger men for concern that they're just going to need treatment anyway, or potentially that they may harbor more aggressive disease, and that you may miss the window at treating them. So this is a study that we've done in collaboration with the group at Sunnybrook Health Sciences Center in Toronto, and that's a study that a very well-known active surveillance cohort led by Lawrence Klotz. And we've collaborated with them to put our data together, and we had a total of 432 men in that study. The median age of the men was at the start of active surveillance was 55 years, and there was a median time of 5.1 years of follow-up. So, not it's a very reasonable follow-up time. Obviously, as we follow them out further, that we'll get even more information. So, it was an interesting findings in that at 5 years, 75% of men remained on active surveillance. At 10 years, 55% of men remained on active surveillance. So, so a fair number of men, a significant proportion, remain on active surveillance and avoid treatment. We then looked at of who went to treatment, what was the primary reason, and in the number one reason for that men progressed to treatment was actually what we call pathologic progression. So on a future biopsy, they had either increased volume of disease or an increase in their Gleason score.